Welcome to page 49 of Anatomy Coloring Book, Muscles of the Anterior Abdominal Wall and Inguinal Region. Of course, the anterior means the front. The abdominal wall and the inguinal region, which is sort of the groin, you might call the groin region. Let's talk about the muscles on the anterior abdominal wall. Let's talk about them from the deep layers to the superficial. Starting out with the deep layer, then a middle layer, then a superficial layer. First, let's start with the muscles you all have heard of, the abs. You've heard of the term six-pack, eight-pack, etc. That's these muscles right here. They have a name called the rectus abdominis. Rectus is a term in Latin that means straight. Anytime you hear the word rectus, you should think straight. And so you can see this straight muscle here attaching at the pubic crest here, originating at the pubic crest, and then inserting at the xiphoid process and the lower ribs. So the connection from the pubic crest here to the lower ribs and the xiphoid process of the sternum. The job of this, the action, we have origin, insertion, and action. The action is to flex the spine as if you're doing a sit-up. So the action is to bring the spine flexed as you do a sit-up. Your rectus abdominis right here, flex the spine. And you can see how they're uniquely positioned to do that. Now, the muscle on the side here is called the transverse abdominis. The transverse abdominis muscle. And what this muscle does is, when you contract it, it's the muscle that when you bear down to, say, have a bowel movement, to urinate, or even regurgitating, throwing up food, or blowing out, expiring, it is involved in those actions, creating a pressure, an abdominal pressure, and supporting the abdominal contents, compressing them during these, and containing them and holding them during these actions. So, but the unique thing about the transversus abdominis is the muscle is only for a short period here, and then it turns into a tendon. This white area is very, very tendinous and forms a tendinous sheath, so to speak, that surrounds. And then underneath it is what's called the transversalis fascia, which is just a thick connective tissue, supportive connective tissue underneath. So what we have here is, going vertically, the transversus abdominis muscle, and underneath it, or to the side of it, is the, this is the rectus abdominis muscle, and it's the transversus abdominis to the side. This sheath becomes very important. This tendinous sheath. Most tendons look like what? They look like this. You have a muscle, right? And then you have a tendon coming off it, like the Achilles tendon and the heel bone and the foot. You know, and we think of tendons as these long, skinny things. But this is a flattened tendon, a broad, flat tendon of the rectus abdominis. And what it winds up doing along with this next muscle, let's talk about it, the internal oblique. Rectus abdominis, of course, in red. The internal oblique here, a very similar muscle to the rectus abdominis and has the same function as the rectus abdominis. And it also has a tendinous sheath. And the sheath in this tendon winds up envelop like an envelope, enveloping the rectus abdominis muscles. The third muscle, the external oblique, more on the outside, right, also contributes to this sheath, this tendinous sheath, they're called an aponeurosis. Another word for that is aponeurosis. The tendinous sheath, though they form, the three of them, a tendinous sheath called an aponeurosis that surrounds and envelops the rectus abdominis muscle. So you can see how the three would work in tandem together. The attachment, the muscle comes up to the ribs and inserts on the ribs in the xiphoid process. It comes out of the sheath at that point. And so here you can see the sheath, the aponeurosis, the tendons from the rectus abdominis, internal oblique, and external oblique, wrapping up the rectus abdominis. So if they all contract together, you can envision the rectus abdominis contracting and flexing the spine, whereas these other three muscles here, here, and here wind up compressing the abdominal area, the abdominal contents, and creating pressure inside there. Also, it's known that the obliques, the external obliques, and the transverse abdominis muscle might be involved in not only compressing, but let's use the correct color, but rotating the spine. The obliques, you can think of when you do side bends or side crunches, that's working on your obliques, and they also rotate as well. And then a side bending and a crunching. If these muscles contract, you can see how they would they would sort of crunch the side together, bring the hip up to the torso or to the thorax, the bony thorax. So whereas the rectus abdominis, rectus meaning straight, is responsible for essentially curling and sit up, flexing the spine, these other muscles are involved in rotating it and flexing it to the side, as well as compressing the abdominal contents. Let's take another look at it. Let's start from the deepest layer, the transversalis fascia. Here's another look of it, a slice through the abdomen here. The transversalis fascia, the most deep. The next layer being the transversus abdominis. The transversus abdominis, and here's the aponeurosis. That's the sheath here. Next layer being the internal oblique. And the outer layer being the external oblique, the external oblique. Let's look at how, and you'll notice how the fascia, the aponeurosis, the tendon of these three muscles, observe how it in fact envelops and surrounds the rectus abdominis muscle. Of course, inside here we have the rectus abdominis muscles. The abs, we traditionally know as the abs. The place where the abs meet in the middle, or where the sheath of the rectus abdominis meets in the middle, where the sheath from the right side meets the sheath from the left side. This area right here in orange is known as the linea alba. The linea alba, of course, this is your umbilicus, your belly button here. And the linea alba is a piece of this tendon where the two sides of the tendon or the sheath come together, known as the linea alba. The lower area of the abdomen is known as the inguinal region. This is sort of in between your hips. You might call it the groin area, I suppose, and there's some structures we should know about. First of all, there's a ligament called the inguinal ligament right here, extending from the anterior superior iliac spine to the pubis. And right above it is what is known as the inguinal canal. There's actually a canal here. A canal running from our gut, from our insides and our pelvic region, piercing through our ab muscles, piercing through the layers. There's the canal right above the inguinal ligament. But what is piercing through from the gut and from the pelvic region inside of us to the outside? And what it is the spermatic cord. The spermatic cord, which consists of some reproductive vessels, the ductus deferens and its vessels, the testicular vessels, lymphatics, and in the women, a round ligament of the uterus. It includes the testes. So the testicles themselves came from inside the pelvis and pushed their way out through the abdominal wall during development, and the testicles descended into outpockings of the anterior abdominal wall called the scrotum. Let's take a look. So the testicles started out inside the pelvis, deep inside the pelvis, on the other side of the abdominal wall. When they pushed through these layers, they pushed through all of these layers to get to the outside, to get through and down through this inguinal canal and then out. When they pushed through, they took all the layers with them. They took all of the abdominal layers with them, starting with the transversalis fascia. As it pushed through the layers, it grabbed a layer of transversalis fascia with it and pushed through And to this day, that layer, even in full development, that layer exists. Next, it pushed through the next layer of transversalis. Excuse me, that is the transversalis fascia. Oh, that's the peritoneum. It pushed through the peritoneal layer first, which is the inner lining of the abdomen. So let's call that the peritoneal layer. Then it pushed through the transversalis fascia layer. The transversalis fascia, and I'm sorry that I have these mixed up here, these colors. It pushed through the next layer. So to create a multi-layered sac within or scrotum. Then it pushed through the internal oblique. I'm sorry I'm messing up these colors, but you understand. Yeah. It's like pushing through a layer, it says, of a glove. Let's say you were to push through 4 layers of medical gloves. The 4 layers would surround your fingers. And it pushed and poked through, here we go, and then finally pushes through the external oblique muscle and fascia. Creating this multiple layers surrounding the scrotum. So this is called the spermatic cord that was pushing through. And of course the testes themselves, the male reproductive organ that creates the sperm for reproduction. One of the problems with this is that this inguinal canal, with all this pressure created by the external oblique, internal oblique, and transversus abdominis, the pressure they create in there, what happens is sometimes it creates a weakness in this inguinal canal right here, where the guts and the internal organs of your abdomen will sneak through because of this pressure and start pushing through and through and through and through and through and through your actual guts, your intestines. Your intestines will push through the canal if it gets weak and actually out into the scrotal sac. And that is called a hernia. A hernia is when any, this is called an inguinal hernia. Hernia means something that doesn't belong in one place pushes through to another place. So look, protrusions of fat or intestines, a hernia, from within the abdominal cavity. This can occur at just any weakness in the wall, in the sheath of the rectus abdominis. And this concludes page 49 of Anatomy Coloring Book. This is Dr. Stephen Harkins.